Okay, it's 2 minutes past, so we're going to get started. There are still people coming in. Welcome everyone. It's really good to see such a good turnout today. Just like to remind everyone, we are recording today's session and it will be uploaded on our intranet and YouTube page later in the week. And you should also receive a link when it's ready via email. We'll be sharing the recording in our next newsletter as well. So if you aren't already signed up to this, Mac is going to pop in the chat the link to sign up to our mailing list. And we usually put our newsletters out every couple of months or so. If you don't want to appear in the recording, you can turn your cameras off. If you'd like to turn them back on for the questions and answers at the end, you can. And we've got an hour schedule, but it should be more than enough time and also leave time at the end for plenty of questions. And please add any questions to the chat as we go. Mac will be monitoring these as we go through and we'll return to them at the end of the slides. Just to let you know, one of our speakers needs to nip off early, but we can park any questions and get them answered and shared separately. So just by way of introduction, we'll be introducing people as we go through the slides, but my name's Laura Renwick and I'm a Public Health Senior Research Manager for the NIHR Research Support Service Specialist Centre for Public Health. And today we're doing a webinar on the Public Health Grassroots Awards, which launched last month. The plan for today is to give an overview of the awards before going into some detail on the scope, the eligibility and the selection criteria being used for applications. We'll then look at the benefits and award for the awardees and their employers before moving on to the pilot awards that we ran in January. We'll be hearing from Jess Feldman, who works for City and Hackney Public Health Team as a Population Health Hub Programme Manager, and she'll share details of her award and what the experience was like for her. Unfortunately, Sophie Beckett can't be with us today. Sophie's a Public Health Research Officer working with Birmingham City Council and Birmingham Museums Trust, and she's very kindly shared some reflections that we'll present to you all. We'll then move on to hear from Claire Batey, who's a Knowledge Mobilisation Lead at Newcastle City Council as part of their Health Determinants Research Collaboration. And Claire's also one of the Specialist Centre's Public Health Engagement Leads, and they'll be talking about her local authority Short Placement Award for Research Collaboration experience and how the grassroots are well placed to help people reach the next step in their research journey. We'll finish up with the funding timelines and also how to contact us if you're interested in applying and answer any questions that might come up in today's session. So the Specialist Centre for Public Health, Newcastle University and Partners has 4 key pillars of work. The Grassroots Awards form part of the Local Authority Support and Resources pillar, and that also includes our local authority research practitioners and public health engagement leads, and it's great to see some of them on the webinar today. So the Public Health Grassroots Awards are personal, short-term awards for people working in local authorities, non-NHS providers, and voluntary community and social enterprise organisations delivering a public health function. The awards secure time to be involved in research training and development activities, lend support to a research project, or undertake a placement with an existing research team. And they seek to foster a culture for research within public health at the grassroots level, empowering more individuals to contribute to innovative and informed practices that improve public health and reduce health inequalities. And they also aim to provide a complementary career development offer to the other parts of the NIHR infrastructure, which we'll go on to in a couple of slides. So we want these awards to generate a real enthusiasm for research and use of evidence for people working in the public health space. And they've been designed for those who are maybe research curious, but perhaps haven't had the opportunity to be involved. but we also want employers to see the value of these awards in terms of the flexibility and the part they play in workforce development, and also being able to really create that research culture. So there are three key priorities, with the first being to encourage research engagement. So we want to generate interest and activity in public health research, either for those that have had some previous research experience and would like to progress the learning and experience, or for those that have no previous research experience and would like to use the award maybe to just dip the toe in the water and gain some valuable knowledge and skills. The second is inclusive research engagement. So there might be challenges for some in terms of development opportunities professionally, and funds from the award can be used for childcare or accessibility support, where this will help people to take part in the activities included within the plan. And finally, the awards are flexible and can be tailored to someone's personal and professional commitments and needs. This might be, for example, a condensed 1-week training course, or a half-day placement with a research team, maybe every week for 3 months or something like that. So this slide just shows a simplified version of the NIHR career opportunities that are available currently through the NIHR Academy, and that ranges from that initial experience through to PhD level and beyond. And when the slides are shared, there's a link at the bottom right-hand side, and that'll take you through to the full range of training awards for public health professionals working in local authorities and other non-clinical settings. So what we've tried to do is position these grassroots awards firmly in that initial experience section of the offering, and we see them as the first step to some of the other awards that are available, such as the LA Short Placement Award for Research Collaboration, or LA Spark, which you can see at the bottom there. So what are we offering as part of the award? There'll be 60 awards on offer in this round of funding, with the intention to launch another call in early 2026. We're going to limit for this particular round 1 award per organisation, and I'll talk a little bit more about joint awards in the next slide. The award value is £5,000, and this can be used flexibly. So typically it'll be over a 3 to 6 month period, but we would consider any plans up to and including around 12 months, as long as the award plan's realistic and the reasons are clearly explained. The award can be used as a contribution towards salary costs and the costs of any learning activities included. Applicants will find out early in July if they've been successful, and funding must start any time between then and the 30th of September. And finally, just as a centre, we are continuing to increase our training and development offer, and we have a schedule of learning events. So please consider including some of these or using them to supplement the activities in the award plan. There is a link to the training and development pages within this slide, which you will be shared with, but Mac's also going to include these in the chat now if anybody would like to access them. In terms of scope, the £5,000 can be used to cover a combination of activities, and they're all listed within this slide. The main one includes salary support, and this is really just to release somebody from their day-to-day role to undertake whatever they plan to do. And as mentioned earlier, the time can be carved out to suit the awardee's learning needs with the agreement from their employer. Funding can be used to pay for training and development related to research skills and methods, or to learn about research, inclusive research design, or to undertake work with people and communities. Some might want to take a short placement with a research team and maybe agree some specific activities that'll give them the exposure to an academic environment, to build relationships and help to achieve some of the learning outcomes. It can cover UK conference fees where there's a clear link to the learning outcomes within the plan. And I'd also encourage anyone thinking of applying to consider costs linked to travel or accommodation if it's needed, or any resources that might help someone fully engage with the award plan. So as mentioned earlier, this could be something like childcare costs to allow you to do certain activities, or certain accessibility support like British Sign Language to enable participation. The award description on our funding page gives more details on the scope, and we'll also be providing some examples of what our grassroots pilots use their awards for. And Jess, who'll be coming on later, will also talk a bit more about this in her slides. If you're unsure about any of the activities on there and whether they fall under scope, please get in touch with us and we'll help you as much as we can in terms of eligibility and what falls within the award. So, eligibility criteria. To be eligible to apply for the award, you'll currently need to be working in public health or working in a role that's tackling the wider determinants of health. If you're unsure, get in touch and we can help you work out if you're eligible. You must be employed by either a local authority in England, and this does include local authorities that have health determinants research collaboration funding, providing that your current role isn't directly funded by the HDRC. It can be employed by a non-NHS provider that's commissioned by a local authority to deliver a public health service, or a VCSE organisation that receives a grant or is commissioned by a local authority to deliver a public health service or services. Again, we've had a few queries about these already. If you're not sure, please get in touch and we'll help you along the way. In terms of education, we do ask that you're educated to degree level in any subject or have the equivalent experience that is needed to undertake your current role. Any postgrad qualifications at level 7 or above are ineligible for grassroots at this stage. And the reason being is that there's more opportunities through the NIHR beyond that degree level. So at the moment, we're really keen to focus on where there's gaps in the system, although we are listening to feedback that we're receiving along the way. And, you know, in the next round, it is a possibility that we might tweak some of this eligibility criteria if we're finding that there are gaps that still exist. And similarly, we're focusing on awards for those who are at the earlier stages of their research journey. So some might have some pre-existing knowledge or experience, but it's not needed in order to apply. And actually, we're encouraging anyone with no prior experience to apply and use this award as a chance really just to tip your toe in the water, gain some initial skills and insight into research. So I mentioned on the previous slide and want to highlight that we will accept joint applications. And this could be, you know, a couple of colleagues that are maybe starting at the same baseline, have similar interests and learning needs, and can maybe look at creating an award plan within that £5,000 envelope. And in terms of the full eligibility criteria, we've got most of it up here, but please check the awards descriptions on our funding page. But as I say, please do get in touch as well and we can discuss anything specific with you if needed. Onto the selection criteria. So we've purposely made the application form really light touch and hopefully easy to complete. And there's only really 3 to 4 key questions that we're asking people to give us some words on. So we're going to score applications based on the person's motivation to apply, including any research experience that you have, or whether this will be your first step, reasons for applying, and evidence that you've discussed the opportunity with your line manager and have the support needed to carry out your plan. And it also gives us a chance to tell us if there've been any barriers to accessing similar opportunities in the past. We are in listening mode and we are actively trying to address these. The award plan itself needs to be clear and realistic. It needs to be within the scope. And if it's not immediately clear that it's within scope, please tell us why you feel it is. We also need to see the timescales for each of the activities and the overall plan. So again, we can make sure that it falls within scope and we can kind of see how the award's going to be managed within the time frame. And we'll also be looking to you to hear what you hope to achieve at the end of the award. What knowledge, skills and experience do you hope to gain? Or what relationships or networks do you hope to build as a result of the award? maybe thinking ahead to the future, how might you use your new learning to influence your current role? Are there any other career development opportunities you'd like to explore? Um, so we'll be looking at some of these factors to help our decision-making process, and it tends to be within the scenario where we might have maybe more than one fundable applications, or we're from the same organisation, or we have more fundable applications that we have awards for. And these are just inclusion and reach factors will be taken into account for the decision-making process of the panel. So we are really keen to be inclusive, and it's reflected in some of the steps that we're taking around those costs for accessibility, and by making this new award that's suitable for those at the earlier stages of a research journey and might not have previously had the opportunity to apply or have any other career development awards on offer from NIHR. So one of our centre aims is to increase capacity and capability outside the NHS for public health research. So we're keen to welcome applications that can help do this. So for example, applications might include train the trainer courses or purchase and training that can be undertaken by not just the awardee, but multiple staff. And that would be providing that the employer provides a time out to do this. If you'd like to run any of the ideas you might have past us, just let us know and we can discuss these with you. So here are some potential outcomes and benefits for grassroots awardees. We wouldn't necessarily expect people to meet all of these outcomes. It will very much depend on each person's plan and what's involved, but this list here just gives a flavour of the benefits that the awards could offer. When we were scoping the awards, we were finding that some of the challenges people faced when they were wanting to apply for other awards, like the pre-doctoral fellowships or the local authority sparks, was that sometimes it was difficult to identify an academic supervisor or a mentor, as they had the kind of limited collections with academia and those working in NIHR. So what we hope is that the grassroots can give people the opportunity to help develop these links and also engage via the specialist centre with our LARPs, our fells, and those who have engaged with us and undertaken NIHR fellowships in the past. Also important to note for any employers on the call, our line managers, if you're an employer of staff applying for grassroots, we really want to make the awards to help generate enthusiasm for research and use of evidence in decision making. So by promoting and encouraging staff to apply for grassroots, it does show a real commitment from the organisation and champion a research culture and really helping to drive forward that building of capacity and capability to do research. The people with awards, they'll be developing new skills, knowledge, experience, and that'll be retained and can be used within their roles and shared with others within their teams. And the beauty of the awards is that they're flexible, they'll fit around personal and professional commitments. So we'd really encourage employers to work with their staff and find a plan that fits both you and them. And we'll make sure that there are opportunities to get involved in the centre's plans and contribute to our work. And that's making sure that what we're offering is fit for purpose and co-designed with staff and local authorities and their partners. And this just provides that access to do so. So I'm now going to go on to our grassroots pilot, which we launched in January this year. So the pilot involved funding 3 grassroots awards for colleagues in different roles and different learning plans. Our first pilot involved a colleague from Nouveau Wellbeing, and they've spent some time with a research team focusing on analysing quantitative data and developing the skills. And the award also covered 3 different types of public involvement training. I'm not going to talk too much about the second pilot because Jess has either joined us or will definitely be joining us shortly to do this herself. And the third pilot was Sophie Beckett, who's a research officer funded by the public health team at Birmingham City Council and working for Birmingham Museums Trust. Sophie did a condensed Master of Public Health module over the course of a week and is now using her remaining time to use her new learning and skills on implementation science, and she's going to be creating an implementation toolkit to use in creative health activities with the public. So that was really interesting, and she's kindly shared some reflections, and I'll share these after Jess has done her slides. So I've seen Jess joined, very timely. I'm going to hand over to Jess, and she's one of our grassroots pilots who's recently finished her award. Jess works in City and Hackney Public Health team, and she's going to tell us a little bit more about how she used her funding for grassroots and what she got out of her experience. So I'm going to hand over to you, Jess. I'm going to drive the slides, so if you can just let me know when you'd like to change them.
Thanks very much, Laura. Can everyone hear me all right?
Yes.
Brilliant.
Perfect.
Thank you. Thanks for the introduction, Laura. So my background is in public health, and I regularly use evidence to inform my practice, but I'm much less familiar with how this is developed and how research is carried out and what the process involves. So I applied for the award so that I could do a placement at UCL's Department of Primary Care and Population Health, and get first-hand experience of the realities of research from multiple perspectives. And yeah, I wanted to develop my skills in qualitative research methods. In my role in the City and Hackney Public Health team, I've carried out focus groups and interviews, but I haven't had formal training. So the placement provided an opportunity for that. And I also wanted to learn about the opportunities for building cross-sector partnerships between the team that I work in and academic partners. Go to the next slide. Thanks. So in terms of the activities that were covered, I've been able to do a 3-month placement working 1 day a week at UCL, and that's involved supporting a programme of research led by Jessica Sheringham, which is around data sharing for housing and health. And yeah, I've been involved in a whole range of activities, from developing topic guides, identifying who to interview, carrying out interviews, and hopefully I'll be able to do some data analysis as well. And the awards covered my salary costs for 1 day a week for 3 months, and it's also included some funding for training. So I've completed Introduction to Qualitative Interviewing training delivered by Social Research Association, and I've got other training lined up as well to do shortly. Go to the next slide. In terms of reflections, I think, yeah, having protected time each week for this work over a period of a few months has really helped me to get an understanding of what it's like to work in a research environment, and also being able to combine theoretical training with hands-on practical experience has been really useful. And it's been a very supportive environment, so I've been lucky enough to have a great placement, which has meant that I've had a lot of support and input and advice from my supervisor and others in the team. Go to the next slide. So in terms of next steps, I've applied for an NIHR LA Spark Award, and that's allowing me to extend my placement for a further 3 months. So I'm using that award to carry out further training and also develop my skills and knowledge in qualitative research methods. And that will give me the opportunity to analyse some of the data from the interviews that I've carried out as well, and also develop my subject knowledge around housing and data sharing. And I've also been looking into some of the other awards offered by NIHR. And if we go to the next slide, thanks, Laura. So in terms of benefits to my colleagues and my team, I think it's really helped me to understand more about the opportunities around sharing housing and health data to improve health outcomes and reduce health inequalities, and what I could do locally. I'll be going back to my role with new skills in qualitative research methods, which will support my work. And I also have a much better understanding of NIHR and the Specialist Centre for Public Health and the opportunities that there are in terms of training, resources, funding, and I'm going to be sharing that with colleagues in my team. And also have been able to develop lots of links across the different teams, which I hope to develop further as well in the next few months. Thank you.
Thanks, Jess. That was great. I'm aware that you need to nip straight back off, so thanks so much for coming. If we do have any questions specifically for you, we'll save those from the chat, and I'll get in touch with you after today, and we can get some answers sent out if that's okay.
Brilliant. Thank you very much.
No problem. Thanks, Jess. See you later. Okay. So the next Grassroots pilot was Sophie Beckett from Birmingham, and she can't join us, but she's kindly provided us with some of her reflections as she comes up to the end of her award. I'll just click on these. I won't read out Sophie's comments, but I'll just leave that slide up for a few more seconds just to give you the time to read about what she has to say and how she's felt about the awards, which has been wholly positive, I would say. So that leads us on to our final speaker. Claire is one of the Centre's public health engagement leads, and she covers 7 local authorities in the northeast of England. Claire also works at Newcastle Council in their HDRC, and she's also undertaken a local authority short placement award for research collaboration. So very busy person. Claire's going to tell us a bit more about this and how Grassroots Awards can complement the other opportunities that are available to public health colleagues. So over to you, Claire, if you're there.
Hi, Laura. Thank you. Can everyone hear me okay and see okay? Great.
Yeah, that's great.
So yeah, my name's Claire. I work in Newcastle's Health Determinants Research Collaboration, and I carried out an LA Spark last year now, between March, April kind of time and October, November. So actually quite long for an LA Spark, but I spent 2 days a week with Dr. Mackenzie Fong in the Northeast Applied Research Collaboration. So I've just kind of put some of the benefits of the placement on that slide there. And to be honest, I would say that echo Jess's experience. I think the benefit of the Spark is that it can be a little bit more extensive, and it builds on the grassroots really, really well. So some of the same themes probably come out. Time, for example, that was just having the protected time to actually have that ring fence time to think about research, to do research. Since my placement finished, I've tried to carry on a bit of that, but actually just not having the protected time, you really, really notice the difference in how hard it is to kind of keep that momentum going. So I think time's just absolutely crucial. The expertise as well. So the topic of my LA Spark award was initially around weight management, and it kind of built on some experience I had during my master's. But what I really wanted was to get the qualitative experience. Similar to Jess, I'd probably done things that approximated qualitative research previously, either in my current role or in previous roles when I worked in the voluntary sector. So, we might call it user involvement, or we would do some engagement with residents, but it was never, I never had that sort of formal training other than in a theoretical way during my master's. So just being able to have that expertise was really, really helpful, and to kind of do some interviewing, do some qualitative analysis. And what was really nice as well is that the Spark was quite flexible. So just through the thoughtfulness of my supervisor, really, I was able to get involved in lots of different things, learn about different projects, and what I actually ended up doing, I would say, surpassed what I set out to do. So for example, I got involved in updating a systematic review that exposed me to lots of different types of natural experiment type study, which isn't something I'd covered on my master's in great detail. So just lots and lots to get involved with. The relationships and culture one, I think they kind of sit quite nicely together, but just being at the university allowed me to sort of extend my networks with other academics, as well as my supervisor, and then also to sort of try and use my role in the HDRC to bring researchers a bit closer to the council as well. So I think as councils, we're not the easiest organisations to sort of navigate, I would imagine, if you're a researcher, and we tend to sort of work across so many different things. It's never quite clear who you're supposed to go to, especially with something as cross-cutting as public health. So I hope that I was able to use my Spark placement to sort of bring my supervisor and other researchers who I was connected with into the local authority a little bit more as well, and to kind of get some co-created research projects off the ground. So that seemed to be quite successful. And then there's sort of the more formalised bits as well around formal training and conference attendance. So I was lucky enough to do some funded training around qualitative methods with Oxford University that I wouldn't have been able to access in my council role because it just would have been prohibitive, the cost. And also I was able to attend the Social Science and Medicine Conference as well in Glasgow, which it was beneficial to attend such a purely academic conference, whereas usually I'm more, if I do attend something in a council role, it might have a bit of a research element, but it's much more practice focused. But as well, because it was really applied, there was so much knowledge and exposure to research that I was able to bring back to our HDRC and to colleagues as well, to try and sort of share a lot more. So that's just a bit of an overview of my Spark. Could you move on to the next slide, please, Laura? Thank you. So I guess in terms of the application process for the Spark, I didn't find it that difficult, but I would say, you know, it's similar to Grassroots in a way in that it's quite light touch, but it's probably still not as light touch, which I think is where the Grassroots comes in. And I think there were certain things that helped me with my Spark application that gave me a bit of an advantage that other people might not have. So one of those was working within a health determinants research collaboration. We are funded in local government by NIHR. There are only 30 of us across the UK, so 30 HDRCs. So that's not a typical experience, and it's not a direct connection to NIHR that everyone will have in local government. But I think just having that knowledge and understanding of how NIHR works was something that probably benefited me in my Spark application. Similarly, I'd relatively recently completed my Public Health and Health Services Research Masters, and Mackenzie, my supervisor, was also my dissertation supervisor. So it was a continuation of an existing relationship. If I hadn't had those relationships already, I might not necessarily have known where to go to sort of find a supervisor and even start to have those conversations about placements. So I think Grassroots awards can come in really useful there. And again, because I'd recently done a master's dissertation, I had a clear-ish area of research interest which I could build on. If I hadn't been involved in research for quite a long time, for example, if it had been before I started my master's, I hadn't even, you know, I've been out of university, it's 15 years or something since my undergrad, and it wasn't in a relevant subject, I wouldn't really have known where to start. So I think Grassroots is helpful there. And I think sometimes there's a lot of things that can sometimes seem quite tricky to navigate, similar to probably researchers navigating the council landscape. The research landscape can sometimes feel a bit tricky to navigate, and I think there are probably a lot more staff who are interested in public health research, but if they're not already connected into the NIHR or they haven't got research experience, Grassroots is just a really, really helpful addition to the things that are already on offer. And just as a final point around that, I noticed, Laura, at the beginning, you mentioned enthusiasm, and I think that's a really key thing. And, you know, if we see that in someone in local government as an HDRC all the time, the last thing you want to do is put someone off by having an overly complex application process or having lots and lots of criteria that people might struggle to hit to kind of just get that first entry point into research. So I think it's really, really welcome to have this award where it's really inclusive. It has it's designed with accessibility in mind, and it doesn't dampen anyone's enthusiasm, because just taking those very first steps, I think, can sometimes be the hardest. And that's me done. Happy to answer any questions. Thanks, Laura.
Thanks, Claire. And if anyone has any questions specifically for Claire, you can continue to add them to the chat, and we'll just start picking up on them as we end the slides, which we're coming towards the end of now. So here are the timelines. The awards are now open. They close on the 19th of June at 5 p.m. Decisions on the awards will be sent to all applicants by the 9th of July, and funding can start any time between then and the 30th of September. So thanks so much for listening, everyone. We're coming up to 40 minutes now. If you're thinking of applying, please get in touch. We offer support of application process. We're happy to talk through any specific questions you might have. There's links in the slide to our intranet pages and the mailing list sign up, and Mac will pop these in the chat now as well for anybody who wants to access them straight away. I'll just leave that slide up, and we'll start by moving on to the questions next. So once you put that in the chat, Mac, would you like to start us off with any questions that are in there?
Absolutely. We've had some fantastic questions. Thank you so much, everyone. So Tara, hi Tara in Brighton. Lovely to see you here today. You can correct me if I've misunderstood this question. So Tara has asked, does the award need to be used for a combination of activities as part of a research proposal, or could it be used just for one of the things that you had listed on your slide, Laura? So for example, could it be used solely for a standalone research training course?
Yes, absolutely. So, and I think this probably is reflected of where you are in your research journey, what actually you would like to get out of the award. And as we said, the awards are flexible. So if this is kind of your dipping your toe in the water for the first time and you just really want to do a little bit of training, that's absolutely fine, as long as you list what that training is, if there's a cost attached to it, and that you have the support to take that time out and the salary costs aligned to that as well. It can be any combination of things in that scope. And it can be training and a placement. It could be a placement on its own, but really it's up to you to tell us how you can make best use of the award. It is a limited envelope, so what you can achieve within that, you might need to prioritise, and as well with the time frames as well. But yes, it can be one, two, or all of those things, as long as it's within the envelope. Does that answer your question?
I'm sure it does. Thank you so much, Laura. Lula popped into the chat. Lula, hi in Lancashire. I feel like a radio DJ. Lula's mentioned that she can't access some of our links for the Specialist Centre. This happens on very rare occasions. Just for anyone in the call who is struggling with our links, please do contact us. Our web pages are hidden from Google, and they're Google site pages, and sometimes the odd person has some problems with them. So please let us know, and we can either provide that in a different format or help you to get that access. And then thank you for raising that, Lula. Next question is from Michael. What about colleagues who may have a postgraduate degree in a non-health or non-research field?
Okay, so a couple of these queries have come up very recently, and when we scoped out these awards, we spoke to so many people and we had lots of conversations about what the eligibility criteria would look like. This didn't come up. And I do acknowledge that there'll be people out there that maybe have a postgraduate qualification that isn't related to public health, or it's maybe something that was achieved many years ago and, it's about getting back into that space. In this particular call, it means that you would be ineligible, but as I say, these queries have come up since we've launched the awards. There will be another call next year, and these are the type of things that we'll be looking at and taking your feedback on. And in the future, it's something that we may change as a result.
Thanks, Laura. I'm sure that's really reassuring for everyone to hear. That's great. Lisa has asked, Lisa, you can correct me if I misunderstood. AHP, I think, is Allied Health Professional. So let's see if I get this right. So would a pre-registration MSc Allied Health Professional qualification, so taken to be a registered member of staff but is not postgraduate learning, would that be ineligible? So would an MSc Allied Health Professional qualification be ineligible?
Yeah, and this is where there's maybe the odd module being done here and there, and it's not a full qualification necessarily. I would say with instances like this, please get in touch with us so we can discuss through it, talk through it a little bit more, and work out kind of within the scope and the eligibility criteria we have, whether it would count you in or out. But yeah, please get in touch, and we'll have a further conversation about that. Would really like to do that.
Fantastic. Thanks, Laura. Lorna in Lincolnshire. Hi, Laura. I see your Lorna, your video's on. That's fantastic. I anticipate there will be a number of public health colleagues interested in applying for the award. Given that it's one award per organisation and applications have to be signed off by the Director of Public Health, Lorna is wondering how we will deal with multiple applications from the same organisation. A great question. Thanks, Lorna.
Yeah, so Lorna, there's probably a couple of things there. The first is how you deal with those applications within your organisation, and if you want to take an approach where you'll screen those and decide which ones that you'll allow to apply. From our perspective, we'll take as many applications as we receive, and we'll score all of those. So there's two elements to our scoring process, and I touched on some of those within the selection criteria earlier. So all applications will be scored. If we have multiple applications from the same organisation, we'll then move on to a separate scoring, which is looking at inclusion and reach. And as I've mentioned, we're trying to make these awards inclusive. We're also trying to make them so that it provides opportunities to those that maybe haven't previously been able to access some of the NIHR career development opportunities. So we will be favouring those people. We'll also be favouring where there is the ability to widen that capacity and capability offer. So potentially joint applications is an option, or training courses where it might be train the trainer, where therefore that bit of training can then be spread further to team members and to other members of the organisation. Or potentially the training where more than one person can access it. And that would be on the understanding that the organisation or the employer allows their additional staff time out of their roles to undertake it. So there's a few things there, and I would say please refer to the online guidance for just a little bit more detail around that. But we'll certainly make our decisions based on those factors when it comes to the panel deciding. But yeah, we wouldn't necessarily say only submit one. And also what we will do is we will be able to provide some general feedback, and it means that when we do have these calls again, we'd obviously encourage further applications. And it might be once we've got a bit more of an understanding of what the demand is for these awards and what type of funding we have, and whether we can increase our funding into these awards, whether it's something that perhaps in the next call we might widen it to accept, you know, more than one successful application per organisation.
Fantastic. Give me a thumbs up, Lorna, if that answered your question. I think it did from the smile. Fantastic. Thank you, Laura. Nasima, thank you so much for your question. I think it was said that the expectation is that the role could not be funded by HDRC. So could you tell us which roles from someone working in a HDRC could still apply? Does that make sense, Laura? I might have read that the wrong way.
I think so. So I guess if you're working in a local authority that has HDRC funding, if the role you're currently working in is funded from that pot of money, you wouldn't be eligible to apply, because HDRCs receive funding from NIHR, and within that there will be some ring fenced for workforce development and specifically for HDRC members of that team. So hopefully that answers the question.
I think that's clear, Laura. Thank you so much. There's a thumbs up. Fantastic. Thanks, Nazima. So Kathleen has asked, so if someone has an MSc, they are not eligible for the Grassroots, but potentially are for the Spark. Is that correct?
Yes, and the link on the slides there will take you through to all of the career development opportunities. And I think once you do get to that postgraduate level, it does open other opportunities out there, so that there are lots of opportunities through the NIHR Academy. There's going to be there's different events across this year that'll be looking particularly at the pre-doctoral fellowship, but there's also the pre-application support fund. So if you're not quite in the position where you're ready to apply to those type of awards just yet, it's funding that allows you to get yourself into that position, and that might include specific training and development needs. So I'd say please check out more details on those on the website, on the NIHR website.
Fantastic. Catherine has articulated this really well, and as loops back to the previous question. So I think the majority of our HDRC staff are funded by the NIHR, so I assume we'd be ineligible. That's correct. But the odd colleague who is funded by the local authority might be eligible. So yes, Catherine understood that correctly, yeah.
Yeah, that's right. And I guess it's looking at you know, outside of the HDRC team, you know, there's other departments, and it might not necessarily be people working in public health. They could be working in other departments within the council, but actually does their role link to tackling the wider determinants of health? And often that can be the case. So please spread it more widely than your public health teams, because no doubt there will be people across the council or other organisations that are eligible.
Fantastic. Daniel has asked, could the actual work start before the 30th of September?
Yes, absolutely. So in terms of funding, you can put in your plan that you want to start from the 10th of July, and that's absolutely fine. I guess really we can't let you know whether you're successful until that time, but as soon as we tell you that those activities could start, funding must start though before the 30th of September. And if you're unable to do that, I would suggest maybe you would hold out until the next funding call, which will happen next year.
Fantastic, Laura. You just answered Des's question. Will there be another round of applications and another round of funding? And there will. So early next year is the hope. Saeed, I think your questions have also been asked. Nice to see you here from Nottingham City. Are colleagues who hold a master's degree eligible to apply for this award? Question one.
Yeah, so no.
Nope, so that's a no.
Currently.
Yep. And is this award open to all colleagues working in local authorities, including those not directly employed by the public health team, but involved in other areas that impact the wider determinants of health, such as transport, education, or other departments across the council? And Laura, you just hit that and already said that yes. Is the case. Fantastic.
Absolutely.
This is good. Charlotte, hi Charlotte in Wigan, lovely to see you here. Can separate applications come from the same locality, i.e. within a public health team at a council and a VSCE group? So can you have multiple applications from the same public health team?
Yes.
Yeah, absolutely.
But only one will be awarded.
Yeah.
And in terms of joint applications, it would need to be somebody sat in the same organisation, because actually you would just apply for yourself, I guess, if you were working in a different organisation. Yeah. But two people from the same organisation can apply for the one pot of funding of £5,000, as long as you can demonstrate within the application how you'll use the award.
Fab. Thanks, Laura. This is good repeating these bits of information, because I think it's really helpful for everyone. Nasima, another great question. Could you tell us a bit more on evidence of outcome needed to be produced at the end of the award duration? For example, would we need to be producing some sort of report or show evidence of training? Great question.
Again, we're really conscious that these are small pots of funding for limited amounts of time, so we don't want to make any reporting really arduous on people. There'll be a short reporting form where really we'll want to know what you've used the award for, if it's been how you've outlined it in your plan, or if there's been any changes to that. Any reflections that you've got on the process and how you found that applying for the award has gone, what you've done with the funding and what the outcomes have been, and actually what are your plans for the future? Is it something that you'll take back into your existing role, or will it be something that actually you've enjoyed your experience, you're going to look at the other career development opportunities, or are maybe already applied for something else? So we're just really keen to find out, you know, what the next step on your journey might look like.
Fabulous. Sarah has asked, lovely thumbs up there, is much of the application expected to be filled out by a placement provider?
No, so most of the application form will be filled out by the individual. We want to know what you want to get out of this award, and the plan will be down to you. You need support from your employer to do so. So I think it would be really worthwhile to have that conversation with them and demonstrate within the application that you have in fact had that conversation, that you do have the support to undertake all of those activities. But really it's down to the individual to complete this form, and along with members of the organisation that you might need to include, such as finance colleagues, line managers, and then it'll need to be signed off by a senior manager.
Okay. We've heard from Sue. Sue works at a charity which develops public health resources and services, but have no formal research experience. They've been growing as an organisation and would be keen to co-create our next initiative. Is this likely to be a suitable topic to be selected? Examples so far sound as if they have been a higher research base than we do. So they're believing that they're at a much earlier stage in their research journey.
Okay, I would say please get in touch. We'll set up a call and we'll have a conversation about it.
Fantastic. Look forward to hearing from you, Sue. Katie, sorry, I'm just keeping up with the chat now. I think this question's been answered. Katie and Kirklees, lovely to hear. Are people who are based in a corporate support service or area of a local authority, but whose role supports public health and wider determinants, so policy officers, someone involved in data inputting, our public health staff seem to be super qualified. So is it open to other people across the local authority? And yes, it is. That question's been answered. Fantastic. Cigar, could you please clarify which specific documents are required?
Really good, doesn't it?
Just need to mute people, bear with me. Multitasking. Get back to that. That's all right. Get me back to this question. Right, okay. So could you please clarify which specific documents are required for submission both prior to the application and after receiving an award?
Yeah, so the only thing that we'll need from you is a completed application form. You can download this on our funding call pages on our intranet, and Max already shared the link to that. If you do have problems accessing it, please get in touch and we can send you a Word version via email. So there's the application form. We don't require any other supporting documents. Everything that we ask is embedded within that application form. Once you have the award and you've completed it, we'll be in touch throughout that process and we'll be sending out a report form to complete at the end. So we're trying to keep this as light touch as possible so you can actually just get on and use the award without having any arduous process in terms of reporting back mechanisms. We do want to know what you've been up to, and we do want to know that, if they've been successful, but at the same time, we're wanting your feedback on how you found these, and if you think that there are any gaps we've missed. It already sounds as though there might be a little one there in terms of eligibility criteria and qualifications, and that's something we'll actively look to address for the next call. But yeah, so that's it really in terms of what we would ask from you. I think as well, the only thing to add, we are exploring how we maybe network all of the Grassroots awardees together, and we'll have more information on that once we get to the awards themselves.
Fabulous. Emmanuel has asked, this is a straightforward one, are VCSC organisations eligible to apply? Just to reiterate that one.
Yeah. If you're a VCSC organisation that's either in receipt of a grant or a commission to deliver some sort of public health service or function, you're absolutely eligible to apply. If you're not sure, get in touch and we can talk through with you.
Fantastic. Sue was asked if the PowerPoint slides will be made available afterwards, and they will, along with the recording. Daniel has asked a good question about when the funding would be released. So if someone was to start work in their Grassroots Award, whatever that looks like, from the 10th of July, would the funding be released direct to the council in that period as long as the work commenced before the end of September? So basically, when will the funding be released to the council?
Yeah, we're internally, we're just sorting out those arrangements of when that funding can be released, and we can't confirm that right now. What we've done with previous awards, including LARP funding and FEL funding, we've received invoices from the local authority in 6 months and received that 6 month in arrears, but we're really trying with these awards to be able to pay them out in advance. So as soon as we have more concrete details on those, we'll share them.
Really great question, Daniel. Thank you for that. Rupert's asked a great question. If you're applying for funding for training, so for example, a short course on a particular research skill, does the exact course, provider and date have to be specified, or can you specify the content and outcome you want to cover?
Ideally, we'd like as much detail as possible in terms of the type of course you're doing in the provider. It just helps us really assess whether it's in scope or not. It also helps us to be able to signpost you to some of our specialist centre resources that are available if there's very similar ones, maybe without a cost attached, and you can repurpose that money in other ways as well. So as much detail as you can, but understanding that maybe at the stage that you're applying, you maybe haven't got those details bottomed out, or that might potentially change based on getting those timescales right, but you'll be in a much stronger position if you can provide as much detail as possible. And within the application form, it's actually in a table format about the activity, and there's a few different columns which we ask for information on in there.
Fab, Laura. We're down to our last question. It's such a lovely one. Thank you, Sarah. Could a HDRC host a placement for someone from a different local authority?
Yes.
What a
Yes,
lovely point to raise.
Yeah, that would be fantastic. And if you'd like to advertise your services, please let us know, and we can pop them on our intranet pages and make people aware. Or, you know, if you'd like to approach people who maybe would like to apply and offer that up to them, I'm sure they'd really appreciate it. And I think it'd be a great experience.
Absolutely. So that's all the questions that are in the chat. Thank you so much, everyone. They were really, really great questions. Does anyone have any final questions in our final couple of minutes to raise to Laura? You can take yourself off mute if you'd like to and raise your hand. I think we covered lots of stuff there. Okay.
Okay then. Right, well, we'll bring it to a close. That's really nicely timed, isn't it? Thank you, Claire. Really appreciated you talking today, and thanks, Mac, for monitoring the chat and popping all of those in. Oh, Des.
Sorry, that was a false hand. Sorry, I pressed the wrong button.
We loved it, Des.
On my toes. So we definitely will finish on time then. Well, thanks everybody for joining. The webinar slides will be shared. We'll also get the recordings out to you when they're ready, and they'll be kind of spread all over our pages as well. So please pass them on to anybody who wasn't able to attend today. And again, if there's anybody who would like to apply and just wants a bit more one-to-one support, please tell them to get in touch with the centre, and there'll be somebody here to help. Thanks everyone. See you later.
Thanks, Laura. Thanks, everybody.
Bye.